Hello everyone. Today I will be doing my demonstration on the Klein Bell ADL scale. This is an assessment that is used to assess an individual's overall level of independence while completing basic ADLs. It is an observation-based checklist that is going to be consisting of 170 items. These items are going to be divided up into 6 domains. The domains include dressing, mobility, hygiene, elimination, eating, and emergency telephone use. It is a useful tool in identifying specific performance skill deficits that can be used to target for intervention and to track the individual's level of progression in their overall independence. Unfortunately, I did not have access to a manual or scoring sheet. They cannot be found online at this time. So I'm unable to provide examples about specific questions on the assessment or show visuals for the scoring sheet. During administration of this assessment, the OT is going to use their observational skills to observe the different components of the ADL broken down. This is going to be done by the OT using occupational analysis and watching for deficits in their performance skills. The assessment does typically take between 1 to 3 hours. However, for the purpose of this demonstration, we will be mostly looking at components of dressing, toileting, and mobility. Our client is Dantier. Dantier is a 40-year-old male, status post-stroke, resulting in left-sided hemiplegia. All right, Mr. Dantier, today we're going to take a further look at your morning routine. So exactly what we're going to do, I just want to see what you kind of have trouble with and what's kind of easy for you to do in that morning routine. It's going to consist of getting up and out of bed, so from a bed to a chair, using the restroom, taking a bath, getting dressed, eating, and then we'll make a telephone call, and that'll be it. And I'll just be doing an observation, and we'll kind of look at and see what's easy and hard for you, all right? Perfect. At the start of the assessment, we are going to observe the client doing basic ADLs. For the purpose of this demonstration, we're going to observe Dantier dressing, toileting, and doing mobility. All right, Dantier, we can go ahead and navigate into the bathroom. You can use your walker and go ahead and open that door. As you can see, he's able to use his walker to navigate through the doorway. Open the door. All right, Dantier, you can go ahead and sit on the toilet, and we are going to just pretend to do the... Oh, you all right? Yes. All right, let's go ahead and reach for the toilet paper, and then go ahead and rip a piece off as you would. Perfect. And then you can just pretend to wipe. Wonderful. And then flush the toilet. All right, let's go ahead and put your pants back on. All right, so now what the OT is doing is observing different components of dressing at this point. As you can see, he's having some difficulty with that. So now the OT could provide cueing. All right, Dantier, what might be easier is if you take your arm and lift up your left leg and place it over top of your right leg. Perfect. Now you can go ahead and put the pants on that leg. As you can see, Dantier required cueing in order to be able to complete dressing. Therefore, he would receive a score of 0 for the dressing component. Let's go ahead and stand up using our walker. Now that we've completed the assessment, we will go over scoring interpretation. So the individual items that were completed on the assessment are scored from a 1, meaning he was able to do the task, no problem, independently, and that's with the use or without the use of adaptive equipment. Both are considered independent. or a score of 0, which is going to indicate that he was unable to do the task or refused to do the task. And this is going, if they receive a 0, that means they either required verbal or physical cues. So when you're doing the assessments, if you have to cue them in any way, then it'll be a score of a 0, meaning they're not independent. For example, we observed the client completing many different task components of the 3 ADLs that were observed. As we mentioned before, there are 3 levels of task weights, 1 being simple, 2 being average complex, and 3 being complex. When it came to toileting, the client was able to complete all of the task components. For example, gripping the toilet paper and flushing the toilet is a level 1. Reaching and wiping after a bowel movement is level 2. And emptying the bowel and bladder were level 3. The client was able to do all of those, so he would receive full marks for that. When it came to mobility, the client was able to complete most of the task components. Level 1 includes operating the doorknob. Level 2 includes transferring through the doorway. However, we did observe that the client did not safely sit on the toilet. He did not reach back or look before sitting down. So he would receive a 0 for that, and that would cue us on what to work on for intervention for safety. Also, when it came to dressing, we observed the client did have difficulty with those task components. For example, he was unable to don his pants without the use of verbal cues. Again, this gives us an idea of what to incorporate into our intervention session, such as teaching him dressing techniques or possibly even the use of adaptive equipment. Lastly, a summary graph would be used with all of the calculated raw scores that we obtained. This is useful in helping to track his progress and observe his level of independence and how that changes over time. For example, if we re-administer this assessment 3 weeks from now, we can better observe if his level of independence increased with the ADL of dressing.